Hello, welcome everyone. Our conversation today is a part of our SANE Talk series, and today's discussion is going to center around student nursing. So if you are a student or you're interested in starting off your career with St. Elizabeth, you've come to the right place. We're going to hear from five wonderful, relatively new nurses and two wonderful nurse managers as well. Kicking off our discussion is Taylor Huffman. She is a fabulous TCU 5D manager. Taylor actually started out her career with us as a CNA. Taylor, at the time you were in nursing school in Cincinnati, what made you decide to apply for a position with us at St. E?
Hi, Victoria. Thank you. So I grew up in Northern Kentucky and knew being a nurse and new to the healthcare field that I wanted to be a part of St. Elizabeth. When I walked into St. Elizabeth in Fort Thomas, I had barely walked into a hospital at all, let alone taking care of people. So I was looking for a place that was a home-like atmosphere, welcoming, and that I could learn as much as possible while I was in school. And when I walked into Fort Thomas, I definitely felt that.
Wonderful. So Taylor, since you started out your career as a CNA with us and now you're a nurse manager, can you talk about the progression from that beginning phase to where you are now?
Sure. So I think my passion for helping others, like all of us in the healthcare profession, really fueled every single change that I've made within my organization and as my career in nursing progressed. So as a CNA, I was able to help people at their most vulnerable state learn how to help them perform things that they otherwise couldn't do that they were used to doing, taking baths, going to the restroom, ambulating. And then bridge that into my RN role. And while working as a bedside RN, my passion grew, but for my peers as well. So I knew I wanted to help take care of people who help take care of our patients. So that's what made me want to go into management and as the A&M and nurse manager. I think my role now allows me to take care of patients at the bedside still, and also the nurses, clerical staff, CNAs that help take care of our patients. And I had a lot of support and mentoring along that process. So without my managers, my directors, even our senior leadership team, the opportunities that I've been given as an employee at St. Elizabeth were tremendous.
Awesome. So Taylor, I do have one last question for you. As an experienced nurse who could go anywhere and do anything, especially in this nursing shortage, why have you chosen to stay at St. Elizabeth?
So I think it's pretty simple. I think that the commitment that St. Elizabeth shows us every day as employees is unmatchable. I don't think that other healthcare systems have that. I think that we are supported every single day. In the pandemic that we're experiencing now, never once have I questioned employment, my job, support, or having what I need to take care of people. And I think that that speaks volumes to St. Elizabeth, the culture that we have and the community that we have, and that not only we want to take care of our community, but also we want to take care of our own. So that makes me want to come to work every single day for St. Elizabeth.
Awesome. Thank you, Taylor.
Next up, we have Amanda Gray. She is a nurse manager on TCU 5D. Amanda, I understand that you were a CNA at Fort Thomas location. What made you to decide to continue to work as an RN at Fort Thomas?
Yeah, hi, Nicole. Thank you. So working here as a CNA, I got to see firsthand the support that new nurses received from the organization. I watched them go through their orientation process. I watched them be supported not only by the frontline nurses on the unit, but by the management team, by the education department. And I wanted to work somewhere where I felt safe going in as a new nurse, where I felt like I could ask all of those silly questions or those scary questions. I didn't want to feel afraid to ask questions or be afraid to not know what I was doing. And getting to watch them go through that and knowing that they were safe and they were taken care of, and they were supported their whole way is what made me decide to stay here and start my nursing career with St. Elizabeth.
Wonderful. Thank you, Amanda. I've got one other question. In our nursing shortage that we're experiencing, why have you chosen to stay with St. Elizabeth?
Yeah, absolutely. during our current status, throughout this pandemic, this last year and a half, the safe working environment that St. Elizabeth has provided, not just safe for the associates and the employees, but for the patients. This organization goes above and beyond for their patients every single day, and they do even more for their associates. I never was afraid of losing my job. I never was afraid to come to work. They supported us day in and day out, 24/7. And that's what keeps me here. St. Elizabeth is a family. They just like you don't turn your back on your own family, St. Elizabeth never turns their back on you. They really do treat you like family.
Wonderful. Thank you so much, Amanda.
Wonderful. So my next question is for Kylie. Kylie is a CNA here with us, and she's also balancing the demands of a strenuous nursing schedule while continuing to work. Kylie, how have you balanced this workload while at the same time continuing to work here at St. Elizabeth?
I balanced a strenuous workload by keeping myself organized. There were times that I knew that I had work and school and my schedule didn't line up. So I needed to keep myself organized and write everything out. There were times where my clinicals weren't scheduled until the last minute, and I was always afraid that my work schedule was going to interfere, but I knew that if I talked to my manager, that she would be willing to help me. And my manager always found a way to help me make my schedule work. So I didn't have to worry about my work schedule, and my main focus was school.
Excellent. Thanks so much, Kylie. My next question is for Taylor Claxton. Taylor is a current nurse with us, and she works on a labor and delivery unit here. Taylor, you also previously worked as a CNA with us. So can you start off by talking about how you obtained your CNA position, and then how did that CNA position prepare you for your position as an RN on a labor and delivery unit?
Hi, Victoria. Thank you. So when I first started with St. Elizabeth, I applied for a med-surg floor. And so I started on the spine and orthopedic floor at Florence because it was close to home and it would be on my way to school so I could go to work and then go to school. And so I really enjoyed that because that was my kind of first experience aside from clinical with direct patient care. So I got to work with a nurse and see exactly what nursing was about. And then I also got to learn my own skills as a nurse assistant. And so I was on that floor for about 2 years. And then I had my OB clinical in nursing school, and I fell in love with the world of obstetrics. And after that clinical, I knew I had kind of found my home and where I wanted to go with nursing. So I looked into transferring to one of the mom and baby units. And at that time, the postpartum unit was hiring for a PRN position. So I was like, that's perfect for school. And then after I applied, it switched to full-time nights. So then I called my HR representative and I told her that I'd have to withdraw my application. And she was like, well, actually, we have a labor and delivery position open now, so we can just transfer your application. And I was like, oh my gosh, that's amazing. So then I had my interview and it went perfect. The manager and the educators, we all bonded over similar passions, and I felt right at home, and it just felt like the most perfect fit. So then I was there for the last year of nursing school, and I talked to my managers and educators about becoming a new grad nurse on that unit, and they were all floored, and I was like, oh, this is amazing. And then quickly after nursing school, I started my orientation process, and it was super beneficial being a nurse aide on labor and delivery because it's much different than being a nurse aide on a med-surg floor. It's less patient care and more like getting to know the unit and stocking the rooms for deliveries. And so it was nice because I got to really familiarize myself with the unit and get to know the night shift nurses and day shift nurses. And so when it came down to the 6-month orientation, you have it split on days and nights. And so I had that relationship with all those nurses, and it made me super comfortable to feel like I could ask questions and go to different people for different things. And so I really had the most incredible orientation process and the best coworkers and managers that I could ever dream of having. It was a really great experience.
Wonderful. Thanks so much for sharing, Taylor.
Thank you.
Okay, next up we have Hogan. Hogan is a new grad in our cardiac surgery recovery unit. He started off with us as a CNA. Hogan, can you describe your experience in the CSR residency program, and how did that ready you for a fast-paced critical care unit?
Yes, of course. So the CSR residency program, it's really helped me prepare for critical care by allowing me time on the floor, but also having classes where I'm exposed to the general ICU setting. So in the residency program, I believe there are 8 classes that that orientees attend, and these classes kind of break down things that CSR doesn't really get to see too much, but still lets me kind of wrap my head around it. So the residency program allows, like for me personally, it allowed for growth to happen without overwhelming me because it was never too much on my plate at once. And CSR, cardiac surgery recovery, it's kind of a very niche unit. So these classes allowed me to feel more confident across the board in a general ICU setting. But the orientation itself was still on the unit. So they have phases set up, phases like 1, 2, and 3, and you kind of get to work your way up from like TCU patients to post-op patients to immediate post-op patients like OR day. And that really allowed me to develop my independence at a steady pace without feeling overwhelmed at the end of my shift. And throughout it the whole time, my preceptors, my manager, they were very involved, and they really wanted to make sure that I was comfortable and that I was confident in what I was doing. And I loved the residency program itself.
Great, thank you so much, Hogan. Next, we have Jillian, who started off with us in Med-Surg 4 Southwest. She is now an RN on the same unit. Jillian, as a new grad RN in a booming market, what factors played a role in choosing where you were to launch your career?
Hi, thanks. So I started as an aide on 4 Southwest, like you said. I really appreciated the medical surgical experience. I think it's really important. I mean, not for everyone, but it is important for nurses to have a good foundation. So that's one of the reasons I wanted to start my nursing career here. And then in terms of why I chose St. Elizabeth specifically, I care very much about the underserved population of Northern Kentucky because that's where I'm from. I am very passionate about taking care of those who can't take care of themselves or have been left behind a little bit by society. I like to advocate for them. It means a lot to me. And no other organization around here has as many drives and community outreach programs as St. Elizabeth. We always have some sort of food drive, or like the NICU is doing a board book drive, and we do Christmas drives for kids. And that's really important to me, is the community outreach.
Wonderful. Thank you so much.
Yes, absolutely. Next up, we have Megan Sheridan. Megan is a nurse in the NICU with us, and she also worked previously as well as a patient care technician in the NICU. Megan, can you provide a little background on how you began your career at St. Elizabeth, and then describe some of the challenging and rewarding aspects about working in the NICU?
Yeah, so I actually went to school at Thomas More, and I graduated last May. So I've been a nurse for a little over a year now. And prior to that, I had worked PRN in the NICU as a patient care technician. So with that, I got to do like vitals on babies and help nurses with procedures, or just be there to observe and learn in that kind of environment, because it is different than being a CNA on another floor. The NICU is very different. And so then once I graduated nursing school, I transitioned into being a nurse on the floor. And I went through the residency program where, you know, I had different classes with practitioners, and I also had a mentor and support from my managers and educators the whole time. The NICU really is a great place to work. Sometimes it can be very challenging, but it's also one of the best things. I think initially when we get kids and, you know, the parents don't know anything about what the NICU even is, educating them is probably one of the best parts of my job, and making them feel comfortable and knowing that we're there to take care for their infant. And that's what we love to do, and that's what we do every day. So I think, you know, helping the infant in each of those circumstances, and then being able to educate the parents is probably the most rewarding thing about it.
Wonderful. Well, thank you so much for all of your answers. I know I have learned so much just sitting here and listening to you all discuss the place that you are most passionate about. At this point, I'd like to open up the floor for questions from our audience members. If anyone has any questions, feel free to jump in. We would love to hear from you, or go ahead and put it in the chat. Okay, well, thank you all so much for attending today. We are excited, and if you have any questions, feel free to contact us or look up careers at careers.stelizabeth.com.